Hello, everyone. Welcome back to another fun episode of Thrive Live. This week, we have some awesome guest speakers. I'll first introduce Dr. Adam Sanford, a personal great colleague and friend. He's a naturopathic medical doctor out of our clinic in California, and he provides wellness care for, and also acute and chronic care for patients of all age. He has a special emphasis on adrenal fatigue, men's health, testosterone support, sexual and reproductive support, bioidentical and thyroid hormone replacement, as well as advanced treatments in gastrointestinal disorders. And so today we're actually going to be diving deep in discussion with him and our health coach, Mia Taylor, on Sibo and the digestion. Mia is an integrative nutritional health coach, both with her practice as well as working closely in collaboration with Dr. Adam Sanford with his patients who are looking to address their gut health concerns. So thank you so much to both of you for coming on today. I am excited to get into this topic because it is a hot topic.
And we are happy to be here. It's been like,
Awesome.
what, 3-4 years since we did the last one? I think it was pre-pandemic. I was sitting in the office.
It was pre-pandemic. It was a while ago. Too long.
Too long. Thanks for having me, Jenny.
Yeah. All right. So let's get into it. Let's should we Dr. Adam first just kind of talk about what is Sibo, because I think it's it's talked around a lot and people might not really know what it really is.
All right. Kind of the off-the-cuff concept of Sibo is it's small intestine, right? It's like if you take your hand, put it nice and big and slap it over your belly button, that's your small intestine, like all that junk in the middle. So if you have bloating, discomfort, et cetera, within a couple hours of eating, that's the area we're talking about. We'll talk more about that. But Sibo is small intestine bacterial overgrowth. So it could be bacteria that your body normally has, and it usually is, or it's bacteria that your body doesn't like that much. And actually in the last year, we've discovered which are the few that are the main ones that drive it. And I don't know, I think there was a study a few years ago that said that something like 20-30% of the American populace has IBS, kind of that trash can diagnosis of there's something wrong between your throat and your pelvis, and they have no idea what it is. And so out of that, 20-odd%, half of that is Sibo. So just in the last 10 or 15 years, through Mark Pimentel and a bunch of other people through Cedars, we've got a pretty good idea about what's causing a lot of these tummy grumbles and stuff that's going on with people. So kind of the high level of a Sibo idea.
Yeah. And I always like to think of Sibo as a spectrum too. And and this is going to be fun because as you know, we've been practicing together for how many years now, and we're similar yet different. But yeah, I like to think of it as a spectrum of imbalance in the gut flora.
Love it. Yeah, that's actually one of the things I think in the in the marketing thing that we sent out. You mentioned like the two most common co-infections that go with it, because like we're talking about a spectrum. You've got all the bacterial imbalance, but something that gets missed a whole ton of time is SIFO, or fungus, yeast, that's going along with it. And then we also have parasitic. And when your regular doctors are looking at stuff, they're rarely looking at those other two. And even when your integrative doctors are looking at it, they might be looking at the fungal, but often missing the parasitic or vice versa. And then you also have the large intestine involvement for symptoms that kick in later on. So is that what you were thinking of when you were thinking of kind of the whole spectrum zone, or what else?
Yeah, definitely. And I think there's, get into the whole spectrum. Yeah. So we got the bacteria balance, we got the fungal, we got the mold, which we all know I love molds, and I got the parasitics, and the digestive function, right? We need the acidity from the stomach acid to set the ecology, and we need the bile to be dumping to help with the motility. And I find that, I'm sure you do too, but the gut's so interesting because it's so dynamic. It's such a great organ, right? It's not black and white.
And it's like one of the ones where we have all these tests, but at the end of the day, it's kind of a black box. Yeah, even what you were just saying about the function part. If you're not engaging with your food, smelling your food, tasting your food, thinking about your food, if your mouth ain't watering, your stomach's not making digestive juices. And if digestive juices aren't there, you're just like throwing a log onto a match instead of a fire, and you don't have the ability to break it down. You don't do that. You stick this unbroken down food into the top of your stomach to get digested, and your body's just not ready for it, causing all that downstream stuff that you're thinking of. Mia, you talk to people all the time about this stuff, and you just came out with a book like yesterday on this. Was that right?
Yeah, yesterday it's officially launched, which is exciting. But yeah, I talk a lot about in health coaching, really teaching people how to eat, how to chew their food, what their food should be like in consistency before they swallow it. I also talk to them a little bit about like how cooking in the kitchen is actually the first step to digestion. You're seeing your food, you're smelling it, you're taking the time to allow your body to prepare everything that it needs to prepare in order to properly digest the food. So for some reason, this blows people's minds sometimes, but they get to a restaurant, sit down, and the food just arrives. They go from not digesting at all to eating, and probably eating too quickly with too large bites. And then they wonder why they're bloated. Might be you too.
Yeah. And how many of us are guilty or get caught of eating in front of the computer? We're at work, we don't step away. And especially when we're eating in front of that computer at work, we're engaging that sympathetic nervous system response, not the parasympathetic, which is digestion.
The worst thing that people could do would be to sit on their couch and eat while they're watching a scary movie. I'm like, your nervous system is all out of whack. You are not digesting. Just bring it to a calm level.
Yep.
Yeah, like that's one of the reasons why kind of old school, Dr. Jenny, you and I have been giving out digestive bitters, right? Take some 15 minutes before you eat. That at least jump starts the stuff. So if you can't quite slow down like you should, at least you can lie to your body and tell it that it's ready to start eating and digesting. Dr. Jenny's the one that got me into old school herbs in the first place. Our little witch's cabinet.
Right, you get me into
bottles of
pharmaceuticals, so.
Such a nice balance, you two.
Yeah, but that used to be my trick, back in the days of when we were in the clinic, and we were seeing high load of patients, right, running IVs all over the place. It's hard to dial that nervous system down. So if you want to trick it, shot of bitters right before you eat gets it going. So let's talk a little bit about the diagnosis of Sibo and how that it can be challenging and tricky.
Yeah. And Mia, jump in at any point, because I know you have a lot of thoughts and knowledge on these areas too. Normally, so I had a patient just the other day where, and this is at Kaiser where they don't run a whole lot of testing, but frequently Sibo, like, classically according to the rules, it's diagnosed with this thing called the Rome 4 criteria. Now it's the Rome 5, where it's like, if you've had gut symptoms X number of times, X number of who's what's it's, then you have IBS-D, which theoretically is probably Sibo, and they'll throw Xifaxan at you. So it can be done clinically, which, sure, it's kind of okay. But most of the time, we diagnose it using a breath test. It's a lactulose breath test. And unlike the breath test that maybe a lot of people might have done with their doctors previously, where it's the H. pylori test, where it's a blue bag and a pink bag, and it takes 10 minutes. The lactulose breath test is you're blowing into tubes for 3 hours, and we're looking at the gas over that time. And kind of if the gas goes up as the sugar stuff goes through your gut, then we just sort of assume that the stuff that's making the gas go up is bacteria. And so we're able to sort of get an idea for where in the gut that gas is being made. And so that's the typical way that Sibo is diagnosed. And I'm sure you'll have lots of thoughts about places that can break down. But one of the biggest places that we see is that you have people running those tests, and then the test at the bottom is just going to say they do have Sibo or they don't. And that's just based on algorithmic stuff. But it's the knowledge of the practitioner to be able to really interpret that test. Like if it's flat across the board, something's gobbling up the gas and making it look weird. If it's super high across the board, maybe there's something in the colon going on. Or if it just kind of wiggles, then that gives you a totally different picture. And that's where you start to read between the lines. You're thinking about parasites, thinking about yeast. thinking about a third type of Sibo that's not in most of the tests, called hydrogen sulfide. And there is a test that tests for hydrogen sulfide, but it's not my preference, and that's a totally different conversation. What are y'all's thoughts about kind of the various diagnosis methods?
Yeah, so I was going to follow up your comment with another comment of what are some of the other, discussion of the other testing that we should be thinking about? Because we were just discussing how Sibo is a black box, right? It's this dynamic system. So how should we be testing for yeast, for mold, for parasites, for digestive insufficiency, all these other factors that are playing a dramatic role in our ability to rebalance the ecosystem and to actually bring back in digestive balance. And I know I have my favorite tests, but I want to know what your favorite tests now, because we haven't talked about this in, I don't know, a year or two.
Yeah. So your favorite test is organic acids test, right?
I do. I like it a lot.
They are awesome. They are super awesome. Quest Diagnostics has a new-ish test called Candida Immune Complex, which tends to correlate pretty well with my clinical and treatment experience for if somebody has like a Candida albicans, like your regular yeast overgrowth in the gut. I kind of like that one. Honestly, I hate to say it, the best yeast test that I have is treating for yeast. And I really, if you're treating for yeast with a tool that only attacks yeast, which is fluconazole or itraconazole, or maybe the mega mycobalance that you introduced me to. If those things do something, then you've got yeast, because most of the tests, like the stool tests, if they show any yeast at all, my assumption is there is a gob of yeast to make it that far. Because like, remember, you've got your mouth, you got your stomach, and then you got about 20 feet of intestine. If you've got a whole bunch of yeast right at the top, well, that yeast has to make it 20 feet until it gets to something that you test in stool. And you got a lot of digestive enzymes, a lot of bacteria, a lot of stuff that could completely destroy it. So I view the stool test for yeast as a lot of false negatives. Same deal with parasites. If you see it in the stool,
100%.
oh, you got a lot. But if you don't see it in the stool, that doesn't necessarily mean that you don't have any parasites. And so it's a lot of clinical and provocative testing. What are your
100% agree.
Mia, what do you think?
Well, I think that so many people, especially in North America, with the ingredients that we have in our food, the diet, the hidden sugars, so many people have Candida overgrowth in the gut that I think it's totally a safe bet to throw some fluconazole or itraconazole at it and just assume that it's probably there, even if it's only a small portion of the issue and the root cause of the, gut symptoms. So I'm all for throwing some fluconazole on it for sure.
Yeah, and I mean, that's a similar philosophy I think we see across the globe in infectious disease, whether it's Lyme disease or mold or viruses or parasites, is basically, a lot of these things are incredibly hard to test, and you got to go in with your clinical gut feeling and to go in with the treatment, see if you can elicit a response. And then sometimes, you may not know what exactly you're killing, but you're killing something.
Oftentimes what I'll do with people who come to me with symptoms that are, reminiscent of Candida overgrowth is I'll say, try cutting out sugar for a week. If you feel better by the end of the week, talk to a doctor and get it diagnosed and get some treatment for it. Also, there's herbal remedies and herbal supplements that you can take to help, with some of the symptoms of Candida overgrowth. And so when people come to me and don't have, they're waiting to get into a doctor and it's a long wait, I'll say, try this. And if it helps, then you can tell your doctor you did something and it helped. And we tested that. And then that gives them a whole bunch of extra information that the doctor wouldn't have normally had the patient just come in saying, here's what I think is going on. Now let's test for it.
Yeah, that actually, Jenny, let's see how many symptoms we can think of that fit this. Because like when you're talking about the Sibo picture, that's the gut stuff, the diarrhea stuff, maybe some skin stuff. But when you layer on yeast, that's when you get a totally different set of stuff. And one of the things, I don't know if you've run into this yet. I don't think I've talked to you about it. Gobs and gobs of people are having, a mast cell activation system, MCAS, or multiple chemical sensitivity. I've done a little bit of training in that, but not a massive amount. Like I haven't gone off the afferent pathway. One thing I've noticed though is that a lot of those people, when you address yeast, you see a lot of those hypersensitivities go down because yeast kicks up your allergy immune system. All right. So what all do you see for symptoms with yeast? You got the white tongue, itchy skin, sugar cravings, like you have an inner demon that's driving you to eat sugar, itchy ears,
Brain
what
fog.
else?
Brain
Brain
fog,
fog. God, that's
fatigue.
number one, right?
Yeah.
Yep.
Vaginal itchiness, vaginal infections, UTIs, chronic UTIs, recurrent UTIs.
Yeah.
Bloating, huge bloating.
Yep.
True. Yeah. And that's the bloating that like is there like through a lot of the day versus the progressive one that you get a lot of the times with Sibo or large intestine overgrowth. Totally. Overheating easily. That's one.
Alcohol cravings,
Oh yeah.
the
Oh,
sugar
that's another
addiction,
one in blood
alcohol
work.
pathway, carb addiction too.
Yeah.
Your body, your
You-
yeast is actually producing not only an addiction pathway, but is actually making you crave the foods and the beverages that feed it. Kombucha, number one.
Yeah. So
Really?
crazy.
Oh,
Kombucha addiction number one makes me think mold and yeast.
oh, nice. And we're talking about labs a second ago. This is totally indirect, just my clinical experience. But when I see like a fairly healthy AST and ALT, those are two of the liver health enzymes. When I see the AST a little higher than ALT, but they're both pretty, in a good range, I tend to just sort of think that might be an indicator for yeast, just because the yeast is constantly making a tiny bit of booze, like if a person becomes an auto distillery. And that's correlated with treatment a lot of the time. And I doubt there's a study on earth for it. It's just something I've seen, having seen 1,000 labs.
Not directly study on that, but Microbiome Labs did do a study on their HU58 probiotic, which is the concentrated soil, the bacillus probiotic. And they did it on hepatitis. And they actually got improvement in hepatitis and the liver markers, and I believe the ultrasound as well, after like 6 months of their HU58. And there is no other research in terms of why, but I've kind of taken that study and actually treated a lot of hepatitis and non-alcohol fatty liver disease through the gut biome and gotten dramatic improvements in their liver markers just on focusing on gut biodiversity.
That makes sense. I mean, the liver is like the first big old dirty sponge that the dirty stuff from your gut goes through in order to make it to the rest of your body. The crappier your stomach, the better, or the worse your liver, the more you fix it. That's awesome.
Yeah. So kind of like linking in with your idea of the liver and the yeast. So I would say, yes, I think there's hard, like you were saying, hard to find direct research on that, but I think we're starting to actually pull some of that knowledge around it.
That reminds me of
around to
another
liking
symptom.
microbiome. Mm-hmm.
That reminds me of one other symptom for Candida, which Dr. Adam, you've brought this up with people before, but do you wake up feeling like you're kind of hungover or drunk?
Yep.
The grogginess, that's a big one too.
Totally.
Definitely. So while we're on this, I kind of want to segue into the greater orchestra of Sibo. So we've, kind of been touching like the yeast and the mold and the parasites, but, I think dysmotility, and I'm sure Dr. Adam, you agree 100% with this too, because, we've seen a lot of patients come into our clinic who've been seen by other providers and they never touched this whole greater orchestra. And I think that's almost the biggest takeaway message if you're struggling with IBS or quasi-SIBO is it's way beyond just the bacteria.
Yeah. It's like, why did it get there in the first place, right? It's like we're thinking about the little cascade. We're talking a minute ago about the cephalic, the whole like look at the food, smell the food. If you don't have enough stomach acid, you can't break down the food, but also that stomach acid goes into the top of your small intestine, that kicks off your liver and your pancreas doing their goodies, but it also kicks off your gut moving and squeezing things out. This is the motility, right? And if you don't have the motility going on, then you just have this opportunity for the bugs to hang out in a certain place, create their environment, replicate. It also makes it so that those dudes create a pH, an acid level environment that helps foster the jerk bacteria and not the happy bacteria. So yeah, it's like the enzymes, the acid, the movement. And so we give a lot of motility agents, right? We give the like Modal Pro that has the ginger, the 5-HTP, some other stuff. I'll use the drug for calipride or Motegrity. It's gorgeous. What else are you using these days for
Motility.
motility?
I love gallbladder support. I think there's a lot of gallbladder dysfunction. Like you're not at the stone level of like sludge, right? Ultrasounds aren't going to be picking up the sludge in the gallbladder. But again, my population is women specifically, right? And I'm really, but I'll see all ages, but I'm really, majority of my clientele is 30 to 50. And we see a lot of gallbladder dysfunction. So in my clientele, the gallbladder actually is a key of the motility component. Not for everyone, but.
I gotta ask you more about that. Because
the gallbladder is gonna condense it and then dump the bile, and that bile triggers motility.
Yep, that makes sense. And then the fat load, the emulsified fat. Yeah.
Right.
Mia, what about you with kind of lifestyle stuff and ideas for driving it?
Yeah, people are sitting at their computers a lot and then getting off of work and sitting on the couch. And so I try to help people incorporate in sustainable ways some extra movement at the beginning of the day, maybe in the middle of the day if it's possible, and definitely at the end of the day as well. I also teach people how to do abdominal massage to kind of help assist and move things along. And that's something that people have told me has been really effective for both creating some body awareness of where things might be sitting, where the bloating is, where the tenderness is, but also to relieve some of the gas or to get, kind of some of the movement going a little bit and showing them, okay, well, if it's tender here, this is the small intestine, and here it's the large intestine, and this is the descending colon. So if you rub here and push here lightly. So I think I usually pair it with extra hydration, because people are pretty much always dehydrated, and then a little extra movement throughout the day, and then the massage. And those three tend to be little habits that people can work into their daily life that are very effective. But, obviously Modal Pro and some of these other supplements are key for sure.
I love it.
One of your and my favorite shared patients sent me a message this morning that she got a kind of an abdominal lymphatic massage on top of the yeast treatment that we're doing right now. And it feels the best and least bloated that she has in months. Like she'd forgotten how good she can feel. And a lot of that happened with the yeast thing, but also with a lot of that gut touching. That's fantastic stuff.
Opening up those drainage pathways is so important.
Drainage. Dr. Jenny, tell us about
I do
drainage.
so much with drainage. So for those listening, drainage is the concept of opening up routes of elimination, not, from our large elimination routes, breathing, pooping, peeing, your menstrual cycle, your sperm, sweating, but also to the micro drainage pathways, just getting your cells to release toxins, the extracellular matrix, the lymphatics. I've gone down the rabbit hole. I've drinking the Kool-Aid of drainage because there's so much environmental toxins in our environment that we're bioaccumulating that's affecting, and we only understand the tip of the iceberg to environmental toxicity and how it's affecting us medically. At least I think so. And how is this interplaying with Sibo? How are heavy metals and glycophosphate Roundup affecting our biome and ability to get over Sibo? And 9 times out of 10, I walk patients through some concept of a drainage or detox therapy and you got to be careful because you could easily set someone off. And they're doing better. The body wants to heal. I feel very old school naturopath but the body wants to heal, and we just got to get oftentimes those roadblockers out of the way. I know that was a big step for my personal healing, but I see it again big in my client population. That's a lot of this chronic fatigue, post-COVID, long haulers. Everything happened. Everything blew up. But it does make me think, how much of these environmental toxins, the glycophosphate, the plastics, well, how is that affecting our biome, the mucin barrier in the gut?
Hugely. As far as everything I'm reading, yeah.
Yeah. And speaking of environmental toxins, take a moment to talk about my favorite topic, stress, and how that affects our gut. Dr. Adam, do you want to start?
Oh, sure. Where do we want to go? How about stress coming in, kind of triggering that ongoing hypervigilance, driving that sort of fight or flight anxiety thing, that fight or flight going out to your lizard brain, and that's kind of super protective, shooting a signal down your vagus nerve to your stomach, telling your stomach to get all wiggy. And so either it can go into like this pseudo diarrhea thing or shut things down, right? And when you shut things down, that kills motility, which we've been talking about. It's tons of other things, right? What else do you find stress kicking?
I see it everywhere. I mean, and sometimes it's hard to tease out, right? How much of the gas and bloating, diarrhea, and constipation is more stress based, and how much of it is bacterial based, or depending on the case. But also, I think it's really hard to ask our brains, "Are you stressed?" Because you're asking your own brain to compare itself against itself, and so asking yourself, "Am I stressed?" Well, right now you might not be, but a comparison, you might have this ramped nervous system tone. It can come from childhood, infancy, how we were raised, nature versus nurture. And then your limbic system takes all of your history, reprograms how you respond today at that vagus nerve basis. And so I've recently been really going down this track of investigating deeply with patients how their nervous system is wired and how it is affecting everything from gut to hormones to thyroid to everything.
Totally. I'm so glad I have Mia on my team now because she has a huge focus in this. And yeah, maybe later on, maybe tell your story at some point, because that's like super relevant for people. But from the stress picture, I don't know if I've shared with you yet, Dr. Jenny. I have a therapist that I work with kind of after they do some of the initial thinking through lifestyle stuff with Mia. I have a therapist out of Australia where her only shtick is the brain anxiety gut axis. So, 30-40% of the people that I have coming in for gut, I'm like, go chat with Michelle White for a little bit. Plug Michelle White, happyinside.com.au. She's awesome.
Awesome.
And she's paid an Australian money, which is like monopoly money. I don't know. It's really well priced compared to Los Angeles prices.
Yeah, I did a talk last week on Thrive Live on the neurobiology behind addiction, and a lot of it went to the gut-brain axis.
That makes sense.
Yep, and actually is the gut-brain biome axis.
Love that.
Yeah.
It's actually I hadn't heard the axis before, but Dr. Heather Zwicky, our favorite immunologist,
Oh, cool.
Brought that kind of axis up into my thought process at one of the lectures that I had attended. And it's actually, we might be coming to hear more about it in medicine now. This whole gut brain is specifically gut biome brain axis.
And they just patented FMT, so fecal matter transplant pills. So you can no longer get FMT like through a poop bank to fix your gut, because it's gone through the FDA approval, and now you can get it like through a specialty pharmacy. I totally bet they're looking at how to increase the approved usages. Yeah, brain will be the next one. You'll have like poop antidepressants.
That's awesome.
I mean, that's great.
That's
Yeah.
great, Valor.
Stress is a huge one for people. I see it, I have people that I work with that kind of do an assessment at the very beginning of our time working together. A week of tracking their food and their symptoms and their dominant emotions for the day, but also their stress level at the beginning of the day and the end of the day, and then having people kind of look at that over time, over the course of a week, and then compare it to after we've introduced some like nervous system regulation tools and some stress tools, and then a couple weeks later looking at it and having them compare, which is just really eye-opening for a lot of people. The other thing that I tend to do with people is most people now have some sort of heart rate vitals monitor on their phone or on a Fitbit or their watch. And I'll say, yeah, or an Oura ring or something like that. There are so many options now. And I'll have people say, occasionally just check out your vitals, see what they are. If they're, out of whack, chances are you're feeling a little stressed, even if you don't think you are. So giving people the tools to kind of monitor their stress, because like you said, Jenny, that people, you're telling your brain to compare against itself, and self-preservation says, I'm not stressed, just keep pushing forward, so I think if you can give people tools to monitor it themselves and get a baseline and not ask the brain to try to do it, then people become more aware and implement some of those strategies for stress management.
Definitely. So let's dig into therapeutics. And Dr. Adam, I'll give you the floor on this one. Medication, alternative, herbal, and what are the 5 ways that you focus on approaching your treatment?
Well, and this is just like from the straight up Sibo, let's rebalance bacteria thing, because we totally have the improved digestion function, drive motility stuff, change the pH, fix the happy bacteria biome, feed the large intestine, the psychosocial part, the anxiety, vagus stuff, all that stuff. This is just like the how do we murder bacteria to get things out of the way from the Sibo picture. And this is like my little dog and pony show thing, right? It's like, we've got 5 things to do. Absolutely nothing. That is thoroughly always an option. If somebody has labs that scream Sibo, but they don't feel too bad, well, that's their choice. So you always want to keep in mind doing nothing is a possibility. Now, if they're seeing you and I, that's probably not why they're there. You can eat like a gerbil until you die. There's the low FODMAPs diet, which removes all of the foods that chemically annoy all of the different types of Sibo. And every single one of the low FODMAPs diet is overkill, because what they did is everybody has taken a list of foods that annoy certain types of bacteria and glommed them together so that this diet is just way more than any one human needs, but it's a superset. So like, if it works, you probably don't need a portion, but it's hard to figure out which ones. That's why you go see me. So that's the low FODMAP one. But eating a low FODMAP diet, while it helps reduce symptoms, it's rarely going to just by itself rebalance the microbiome. Plus, it gets rid of a lot of the fermentable starches, which feed your happy bacteria in your large intestine, so you can end up actually making things a little worse. Let's see, elemental diet. So with this, you're consuming only this kind of really thin, mega sweet protein shake for 2 or 3 weeks. So rather than like taking an antibiotic or an herb which kills bacteria, you're just starving them. You're just letting time do its thing. So it's pretty naturopathic, right? I did it for 10 days. It's annoying. You're kind of hungry, but it's not the worst. And you'll have a lot of people that have gone seeing dozens of doctors, worked on all their Sibo and stuff. They've done all the pills until they finally go, all right, fine, I'll do the elemental diet. And suddenly they're like, oh, that's the best thing ever. And because it works. 4th, herbs. Herbs are great. They're natural, right? We're naturopaths. They're wonderful because they're broad spectrum. They cover all kinds of stuff. The problem is they're broad spectrum, so they also kill happy bacteria as well as bad bacteria. And if you do it like I do, because I don't fiddle-faddle around it, we go after it. It's a lot of pills. You become like a Pez dispenser. You're a professional pill-popping machine. for a month, which means it can get a little expensive. You can get some kind of oregano burps, but it works really well. It's nice. And the kind of benefit of the herbs are it also covers, you can stretch it to cover parasites, stretch it to cover yeast. So they're pretty cool that way. And then fifth are drugs. The two pharmaceutical antibiotics that I use for SIBO is Xifaxan, which is kind of the main heavy lifter, and then Alinea, if there's methane involved, which also does double duty with parasites. A lot of doctors use one called neomycin for methane. That's not my favorite just because of a certain side effect profile. Mostly with men over 50, they have hearing issues, but it's good enough for me. So that's sort of the 5 for just the bacteria killing stuff, not going too far into other spaces. What are your preferences? What do you like to use?
Whatever works for the patient.
Yeah, that's kind of it.
You know,
They're
'cause
both their
it's-
ethics and their bodies, right?
Ethics, bodies, finances, you know, how much is viable, how much is realistic, how many pills is it realistic to take, timeline, and on what their body can handle. You know, is Alinea going to, are they going to have trouble with, well, yeah, I tend to again have the more sensitive patients. So, you know, but you can also be super sensitive to the herbs. So, you know, how is their reactivity? Are they going to be able to handle the therapeutic? So personally, yes, I love the herbs. You know that.
I do too.
Because, you know, it's getting, a lot of them have antifungal, anti-mold properties, you know, anti-parasitic. That also brings up the question, I don't know if Dr. Rabar, I'm assuming he's still in this camp, the gastroenterologist in LA, of Lyme disease and SIBO connection.
Last I heard, it's definitely still a thing that he's focusing on. And I referred somebody to one of his partners the other day to investigate that. I haven't thought too much about it. What's your take on it?
I've only had a couple patients who had SIBO who had Lyme together, and I've gotten more into the Lyme world now, the crazy Lyme world. And, you know, not every, I guess I don't see that connection that as often as I thought it would. It's there, but
Yeah.
it's not that common.
I think it's maybe one patient out of a whole bunch where it came to mind, and you know, selection bias. But yeah, it's a thing, but maybe not a huge thing in your or my patient populace.
Well, and I think the whole why it is a thing is because, you know, in order usually for a big infection like that, it's a disruption, just regulation of the immune system and of the entire biome of the body. So that's why there's going to be a connection. It's not like SIBO gives you Lyme.
Yeah, totally.
Yeah. But yeah, I think I'm still doing I would say the old school naturopath approach of kind of pulling back, focusing in on the orchestra, looking at the, you know, gallbladder, the motility, the stress, the immune regulation, and then choosing some variety to kill the bugs if we need to.
And honestly, that's the best way to go. Like when I started doing it, I was all SIBO, kill bacteria, rah, rah, rah. But like, I don't know if you know this, from you're in my old school, there was a throwdown between one of the doctors named Dr. Collins and another one, Dr. SSL, where they were kind of like old school naturopathic versus new school SIBO. And it was fun to listen to the two arguments. And there's definitely a happy space between where the old school stuff totally shouldn't be forgotten, because you can kill SIBO all day long, but why was it there in the first place, right?
Yeah.
What were the underlying causes?
Yeah, and I was one of Dr. Callan's students, and I remember being on his clinic shifts, and you know, he goes deep into constitution of the patient.
Yeah,
you know, very old biology constitutions, and every time I've remembered to integrate that stuff into my care, patients generally do better, right? Because we're combining medicine in with the constitution of the patient. So it makes sense.
Yeah, I think that's where we're all trying to circle back to, right?
Yeah, for sure.
That's one of the reasons why I've enjoyed engaging Mia in with my patients is, with just the doctor one-on-one visits, you can get things started, get them, focusing into the lifestyle, focusing into the old school stuff. But when they're only seeing you and I like every, 4, 6, 8 weeks, people lose track of that. Whereas you've got somebody like Mia or maybe Meg, where they're sitting down and working with the people weekly or every other week to keep them moving forward on that underlying old school health stuff.
Yep. And I want to make sure we don't run out of time to talk about Mia's story, because I know you said that
Oh yeah.
Mia has a story that can be very useful to listeners.
Oh, well, thank you. Yeah, it's, I mean, you were talking about stress earlier, and that's a huge, huge part of my story. I was diagnosed with ulcerative colitis after a few years of struggling with different symptoms and not knowing exactly what it was. But what started it all was living a really stressful lifestyle, both emotionally, physically, not eating the right foods, basically waking up and having coffee and then doing my stressful job and not eating and feeding my gut the things that it needed. And I became really sick, and I started going to doctors, and they were able to help with symptoms on an acute level, but I wanted to get down to what the root cause of it was and fix that issue. And I ended up actually finding Dr. Sanford through a gentleman who wrote a blog about how he was able to manage and control and then eventually go into long-standing remission of his UC. And Dr. Sanford and I worked together for a bit, and then I ran with kind of different modalities from all over the world to heal and to really fix my gut, and then also adjust my lifestyle. Made some really huge changes in my life to support a healthier lifestyle and more emotional wellness, mental wellness as well. And it's been fine ever since then. So I'm now helping other people kind of see where their life might be contributing to their physical health and their mental wellness and things like that, because it's really a whole picture thing. People think food is what a health coach addresses, but it's so much more than that. It's really an integrative and whole lifestyle approach to both gut health as well as just general wellness. So that's what I really get a lot of fulfillment out of these days. And yeah, I love it. I love working with Dr. Sanford. I love working with patients. I love gut health in general, but it was a huge issue of mine for a very, very long time, nearly dying to now thriving and helping people do the same. And
to kind of, I guess, emphasize what you're doing and part of your story, you said ulcerative colitis, right? That's an autoimmune disease that typically for doctors, you're talking about hardcore oral steroids, and then a lot of those drugs that you see on TV, where 50% of the TV drug was them talking about all of the side effects. So you were able to avoid these big, gnarly immune modifying drugs with lifestyle, nutrition, and stress modulation?
Yeah, lifestyle, nutrition, stress, really fortifying my gut microbiome, healing the lining, really doing everything I can to keep my immune system functioning healthily. And now I don't take medication at all. I support my body in the way that it needs. And I supplement with herbal remedies, but everything that I'm doing now is super all natural. And yeah, it's all the immune system, and that starts in the gut. So yeah.
So you health coached your way out of a chronic, uncurable autoimmune condition, according to modern science.
Yeah, pretty much. I can't tell you the number of
That's
hours
awesome.
I spent poring over journals and clinical trials and blog posts and everything I could get my hands on outside of going to medical school.
Not a bad story, huh, Jenny?
Yep. It's pretty nice. I like it. So, since we're kind of getting towards that time, I want to just wrap up anything that we missed, any last gut magic that you have to impart.
I'd say emphasizing the stress, emphasizing getting the stomach acid being produced, bitters, taking your time, helping all those fundamental things so that all of the processes at the beginning of digestion work. Because you can kill the SIBO all day long, but if the foundational underpinnings, stress, sleep, water, stomach acid ain't working, it's going to keep on coming back. I think, Jenny, finally, I'm completely coming full circle back to embracing the original naturopathic medicine that you and I fully started out with after my brief interlude of lots of drugs.
It's all right. I appreciated
remember
that
these
brief
things.
interlude because it got me into doing, exploring the pharmaceutical world more too. So yeah, I would say I have the same parting magic message is just everything that you've just said, right? It's gut health is dynamic. It's not a simple box. And to keep challenging your healthcare providers to keep thinking bigger.
Because we love that.
You and me do.
I have learned so much in the last couple of years from TikTok. My patients coming in telling me these things from TikTok, like, that's a what? Then I go off and I look at the study. It's like, oh, okay, yeah, I guess I'm learning something new from TikTok.
Yep, I've definitely picked up some new things from patients being like, hey, can you look into this? I heard about this. And I'm like, okay, that's actually a thing.
Yeah, that's a thing. Mouth taping, who knew?
Mia, any last parting magical words for the gut health?
I think just knowing that there are people out there who are ready to support you in this healing journey, and that there's so many resources out there, and to do some self-education, but don't over Google everything. Seek out the support that's right for you, and try not to do all of the trendy detoxes and things on your own, because really that should be done with somebody who knows what they're doing. But to learn as much as you can and be aware as much as you can of your body and what it's doing and how it works, because that knowledge is really powerful.
Wonderful. Well, if you guys would like to connect with Dr. Adam or Mia, you can go to nawellness.com. Also, for those listening, we'll be coming out with some announcements and telling people how we're going to be moving you to a different Thrive Live platform. But we now have an app for Thrive Live. It just launched yesterday. It's on Google and Apple. Magic hands. I swear it was magic to make them both go live. And so the accessibility is going to be even easier to get onto the Thrive Live calls and to actually watch all the archives. So we'll be coming out with information about how we are transitioning everyone over. And I believe next week is on the vaginal microbiome. I know I've been changing around the schedule of talks a little bit, but I believe next week is on that. So before we go, I don't want to forget to ask, is any of those currently listening have any questions before we jump off? If you have a question, just feel free to pop it into the chat box or raise your hand and I can unmute you.
This has been such a great conversation. I just know that it's going to help so many people as they watch it either live or through the archives. But I've really enjoyed, having this conversation with you guys. So thank you so much.
Good.
Yeah,
my mission is really to change our discourse in medicine for more this grassroots effort. And you look at some of the big changes that we've had in the healthcare, and they've come from the patients demanding a different type of care, a different level of care, different therapeutics. And unless we arm people with this education, that's the only way that we're going to get this shift in healthcare so that people know what to go ask for in their appointments and they can demand a higher level of care.
Yeah.
Well, there
Looks-
is
All
a
right, so we've got
question.
one question that's come on. Post-infectious IBS that included eczema.
Oh, ischemia, lack of blood flow. Oh, was that what you meant when you posted that? Lack of blood flow? Yeah. What's the question? Like, what would
Confused on
we,
that too.
like IBS that's still existing? And is the ischemia like leading to segments of the gut that are not getting blood flow, so have gone necrotic? Or what's and typically if somebody, just like your regular post-infectious IBS hasn't been a super long time, yeah, well, changing the biome help. It will definitely. It depends on how the biome's messed up, where in the gut is the issue. We'd have to know more about what was driving the ischemia, but like that's really as best as I could go. If you're looking at kind of just a high level biome changey thing, if it's not SIBO, then emphasizing resistant starch foods, and then maybe some of the tools from the megaspore people, like the megaspore biotic, the micro. What are you thinking, Dr. Jenny?
Well, I'm gonna kind of go on a limb here. Especially with
Oh, lymphatic.
ischemia, and I don't know if the question is pointed more towards like cardiac ischemia, but there's the gut biome plays a big role in your metabolic inflammation state, and metabolic inflammation makes a huge role in your brain health, your cardiac health, your lymphatic health. And so there's this whole fallout, like a metabolic inflammatory fallout from having the wrong gut biome.
And she was also mentioning gut damage, gut nerves were damaged through swelling. So at that case, maybe the IBS is being driven due to the enteric nervous system, the nervous system of your gut, not firing properly, leading to poor gut motility. Like the immediate IBS tool that comes to mind there is one of the drugs we mentioned earlier, motegrity, because it goes along and it essentially bypasses the nerves and just pokes the small intestine to do its motility thing. And that'll be like getting the motility going is going to be critical towards the bacteria rebalancing. And if it is, if the nerve damage was more due to an autoimmune condition that happens when you have the post-infectious thing, and there's a blood test for this called IB Smart or IBS Smart, something like that. Then another drug called low-dose naltrexone, which is about the most naturopathic pharmaceutical that exists on Earth, can help reduce the autoimmune load that's driving that constant breakage of the enteric nervous system to the muscles in the gut. If you don't fire properly, hyoscyamin. Yeah, this would be like more of an in-depth conversation. Probably talking with your doctor about the motegrity, if it's relevant to you, and then maybe the old school German stuff, Iberogast.
I would even say
and then doing the IB Smart test.
lion's mane to help the nerve regeneration.
Yeah.
Like,
yeah.
I think that I've seen that help. I don't think it doesn't get you 100%, but it definitely can help with some of that nerve regeneration.
And then Mia was talking about the abdominal work earlier. If you had the lymphadenitis, and if there is still much for swelling in there, then getting abdominal work, both probably at like the deep stuff, but also the Barral, the modern Barral style visceral manipulation could go a long way there. And I think just search for like Barral Institute or something like that, and you can find the people that are certified for visceral manip there. Interesting questions. A way deeper conversation to have with Dr. Jenny or with myself to get some thoughts deeper in there. And then with me about how to look at the lifestyle aspects and the dietary aspects to help support you.
Awesome. All right. Well, I'm going to call it because I know I got a patient in about 2 minutes. But thank you so much for coming on today. I really appreciate everyone who took the time to be here. Thank you so much. We appreciate it.
Thanks for having me.
Very happy to be here.
All right. Goodbye, everyone. Have a wonderful weekend, and we'll see you next week.